is BBC Radio 5 Live. Available on the BBC Sounds app. Sunday Breakfast.
Good morning, Helen Skelton and Jeff Lloyd with you until 10 o'clock this morning. The British Dental Association is warning because of backlogs of people waiting to see a dentist, it could lead to some people failing to be diagnosed with mouth cancer. With strict restrictions in place, dentists can only see a fraction of the patients they used to be able to treat before the virus. Dr. Ali Al-Hassan is a dentist at Clyde House Dental Practice in Swindon. It's an NHS practice, but also sees private patients. And Polly Bhambra is a director of Treetops Dental Surgery in Wolverhampton. Good morning, Ali.
Good morning. Lovely to hear from you.
Lovely to speak to you. Good morning, Polly.
Good morning, Helen. How are you?
Very good. We'll get to you in a minute, Polly, but let's start with yourself, Dr. Ali Al-Hassan. Talk to me about your practice then. You're up and running, but how different is it?
So I work in two different places, an NHS practice in Swindon, Monday to Wednesday, and then private practice, Royal Wolf Dental in London towards the end of the week. Both sort of opened on the 8th of June, but we've been massively limited in terms of what we can do, obviously because of the restrictions due to COVID-19.
When you say the key there is you said sort of opened. Is it very different?
It is very, very different. It's different for patients. It's different for us. But the main point I do want to get across is, although we're not seeing as many patients, we're definitely open, we're definitely safe, and we're definitely ready to see patients.
Why are you so, I mean, not to be cynical, some people go, oh, well, they need to get paid. Why are you so keen to say to people, we're open, come to us? What are you worried about? If people stay away, what's the big danger?
So unfortunately, there's so many dental problems that can happen without people actually feeling any pain or having any issues. Chief among those can be gum disease, which can lead to tooth loss, tooth decay, which again can lead to tooth loss, and most importantly, like you already mentioned, although COVID-19 has popped up, oral cancer has not just gone away, and what we're seeing is there's a massively reduced amount of referrals to secondary care for oral cancer, so these patients just aren't being picked up anymore, which is a massive worry for us, because we don't want a crisis where we have loads of people with really horrible and life-changing conditions just sort of sweeping under the radar.
Is that something you would echo, Polly? Are you worried that people are staying away and there could be bigger problems further down the line?
Yes, of course, Helen. This is one of the major issues and concerns as dental professionals we do have. Patients are reluctant to come to the dentist even if they might be worried, thinking, well, I'll wait until lockdown eases and then I'll attend, because at the moment we are getting through all of our emergencies which have been waiting during lockdown period. So, yes, you will.
Polly, can you describe to us what going to the dentist looks like at the moment? I mean, obviously you put different safety measures in place. How different is it to what we're used to?
Hi, Jeff. Yes, it's so different in the sense that the small talk is no longer there, where you would sit and chit-chat with your patients become friends, you discuss about holidays. The communication is totally different. So initially, going to the dentist, what we had to do for preparation before we opened, apart from the deep cleaning, the whole practice had to be fumigated to allow that for fallow time. Again, new terminology which has come into dentistry. What does that mean? Once you've cleaned everything, you have to allow everything to settle. The team had to be trained in a specific way, so there's minimal contact, you're still social distancing. Obviously, you are gowned up, you have to wear your full PPE. The staff have to wear these fit-tested masks, which again, only can be fit-tested with a professional trainer. Patient pre-appointment, the COVID screening question, have you had COVID? Are you living with somebody who has? Do you have the symptoms? Do you have a fever? Have you had a recurrent cough? And little things from saying, please go to the toilet before you come to the practice, please brush your teeth, bring minimal, bags and shopping, leave everything in the car, and of course, wait in the car for us. We will contact you once you arrive on the car park. You ring us, you announce that you've arrived, then we will literally escort you from your car to the surgery at a point where we'll ask you to stop, we'll take your temperature, we'll ask you to sanitize your hands, then you'll be escorted to the surgery. And again, you if you're anxious anyway, and you walk into your surgery and your dentist and his nurse are gowned, kitted up from head to toe with PPE, it just heightens the anxiety even more so. So, yeah, and you're asked if please come unescorted, so don't bring a chaperone. Children, it's slightly different, but with adults, we ask them, again, please your treatment, put your face covering back on. Then we'll escort you. Once you've sanitised your hands again, we'll escort you off the premises. That's how different it is.
What about from the dentist's point of view, Dr. Hassan? Because it sounds like there's a lot going on. Are you worried about your own safety?
I'm not too worried because the precautions we put in place are really safe. Look, dentists have always been, they practice universal precautions, which means there's a set of things we do which make us really safe and protected against viruses, even more so now than ever. So we protected ourselves and the public from things like HIV, hepatitis, measles, and COVID-19 is just sort of kind of the new kid on the block. We do have to do new things. I mean, you mentioned, are things different from my point of view? Personally, I thought that point about chit-chat is so true because so many patients are nervous of the dentist and that's a big barrier for them. And sometimes just speaking to them and talking to them can make such a big difference. Unfortunately, now with the mask I have to wear, I kind of sound like Darth Vader. So half the time, I sound like an evil villain, and the other half, they can't tell what I'm saying.
So you've got people scared to come to you, scared when they get in there, and there you are threatening them with that sort of that big intimidating mask situation. It must be quite frustrating to not be able to do your job as you want to do it.
It is. One of the most annoying things is this fallow time that was mentioned before, so an hour that we have to kind of wait in between patients for many, many procedures, just means that there's a bottleneck. So remember, we have to see all the patients and all the emergencies that weren't able to come and see the dentist over the last 3 months, and obviously all the patients that are coming in now. So unfortunately, we're just not able to see the amount of patients that need to be seen. And, as we mentioned before, that's just going to cause problems later down the line. But I want to emphasize, the dentist has always been safe, and now we're even safer. The dentist is open, and everyone should go and visit their dentist or try and make an appointment to see the dentist, even if it's just for a checkup. And we're hoping that we can open up and start doing more checkups soon.
And what you're describing, the two of you, it sounds incredibly time consuming, which means you've got, as you described, Dr. Hassan, the less time to see patients is causing this bottleneck. A lot of dentist practices are private businesses. Are there worries about it being sustainable? Will we see practices closing?
So that is a real possibility, unfortunately. Just like many other businesses, obviously, if you haven't got people coming in and overhead and costs and all of that stuff stay high, it can be difficult financially, but many practices are soldiering on. They're coping with it. I mean, a lot of the stuff that we've mentioned, like this 1 hour fallow time and, for example, fit testing of these big masks, there's not much scientific evidence behind them at all. And, when we look at ourselves compared to other countries, many other countries have much lower fallow times. They don't have such enhanced PPE restrictions. So the question needs to be asked whether, this is really evidence-based or is it just a little bit arbitrary? And I think the BDA are helping us and doing that for us right now.
Thank you guys so much for talking to us. Well, good luck with everything going forward. It sounds like you are across it. You're doing everything you need to do. Whether you need to do it or not is an evolving situation. But Dr. Ali Al-Hassan, thank you for speaking to us. And, sorry, I'm breaking things in here. I'm breaking things. Don't get mad at me. And Polly Bhambra, thank you so much. Good luck going forward.